In this presentation, we will discuss otitis media. Otitis media is an inflammatory disease in the middle ear. There are two main types, acute otitis media and otitis media with effusion. Otitis media is usually caused by a dysfunction of the eustachian tube in which the fluid from surrounding tissues is sucked into the middle ear cavity. Signs and symptoms include ear pain, fever, and irritability in young children. I would like to show you what a normal ear looks like versus an infected ear. Remember, otitis media is an infection in the middle ear. The photo below shows the connection between anatomical structures of the ear. It should be noted that this is a picture of a normal ear without infections. On the left, you see a normal ear. You can see the external ear canal, the eardrum, and the eustachian tube, which connects the ear to the nose. On the right, you can see an infected middle ear. You can see where fluid is putting pressure on the eardrum, causing redness and pain. You can also see the eustachian tube closing, where pus and fluid form. And you can see how viruses and bacteria have entered the tube from the throat. So who can otitis media affect? Otitis media can affect anyone, but it is most common in young children. Otitis media is one of the most common diseases among children, according to the U.S. Department of Health and Human Services. At least 3/4 of all children experience at least one episode of otitis media during the preschool years. What are the consequences of otitis media? Otitis media can cause a conductive hearing loss, which distorts sounds entering the middle ear. With repetitive episodes of otitis media during the sensitive period of language development, otitis media can have a lasting and negative impact on language learning. Increased risk for long-term language or literacy impairment is greater for children with developmental disorders, such as Down syndrome. So why could a child experience a language delay from otitis media? Remember, sounds can be distorted from a conductive hearing loss. When children have a prolonged conductive hearing loss due to otitis media, they can mishear how speech sounds are produced. If the child cannot perceive the speech sounds correctly, it is likely that they will have difficulty pronouncing them correctly. The disarticulation of speech sounds lead to speech and language disorders, which could be detrimental if gone untreated and can hinder the child's abilities in school. For treatment of hearing loss and delayed language, an audiologist can thoroughly test a child's hearing to make sure they can hear sounds properly. If the audiologist finds that the child's hearing loss is affecting the acquisition of sounds, they can use amplification devices, such as hearing aids. Also, it is a common treatment for otitis media in children for an otolaryngologist to perform a myringotomy, or the placing of tubes in the eardrum to drain the fluid and relieve the pressure. A speech pathologist would be seen if the child had delayed speech and language due to the hearing loss. Speech and language services will help the child recover their skills and not fall behind in their development. Here are the references I used for this presentation. I hope you enjoyed and learned a great deal about otitis media. Until next time!